Happy Friday, Baylor College of Medicine and friends of Baylor. Well, there's a lot of stuff in the news we're going to talk about, a lot of exciting stuff, and then some other stuff. Anyway, very important news. Paul Ling and his colleagues, Baylor College of Medicine and the Houston Zoo, developed, as I've talked about before, an mRNA vaccine for elephant endotheliotrophic herpes virus. This is the deadly herpes virus that kills baby elephants. And I've mentioned before that not only had they saved an elephant named Baby Baylor, but they'd also developed this vaccine, and a 40-year-old and a female, Tess, was the first to receive the vaccine. Well, the Cincinnati Zoo was the first zoo to adopt vaccinating baby elephants. So they took Sanjay and Kabir frolicking at the Cincinnati Zoo and vaccinated them in the fall of 2024. So we already did sort of the phase 1-2 trial in Tess, gave her a vaccine, she did fine, there wasn't any, but she was already an older elephant. These are two young elephants that got the vaccine and then developed, got infected with herpes virus, and which is very common. Almost all of the domestic elephants in zoos get the herpes virus. The difference is that they then developed antibodies and survived. And so this is the first evidence that that mRNA vaccine that was developed at Baylor for these zoo elephants is actually effective. So we're very, very excited about that. And they're doing fine. And the Cincinnati Zoo is very excited about it because their two baby elephants have done well. So what happens normally, if you look at adult elephants, they all have antibodies to this herpes virus. Babies don't, and so sometimes they're overwhelmed by the virus and get an encephalitis or this vascular disease. These two elephants, baby elephants, by being vaccinated, were saved from the virus. So that's very, very exciting news. Second interesting thing in the world is Cambodia now confirmed the 12th bird flu infection of the year. They've had an uptick in their cases. They've actually reported 9 earlier in the year, now up to 12 in 2025. The latest is a 5-year-old boy from the Kampot province who was hospitalized and put in an intensive care unit. This family had a flock of chickens, 40 chickens, and the kid was playing around with the chickens all the time. H5N1 is known to circulate in Cambodian poultry, and the interesting thing about this particular bird flu virus is the recombinant of an old Cambodian clade in genes from the current global bird flu, which again shows that we are likely always to be subjected to things that happen in the rest of the world. So it could be that all of a sudden, someday bird flu becomes infectious somewhere else, but it'd be impossible for us to stop, which is why we always need to be surveilling and be prepared with vaccinations. And then, in one of my favorite, almost nothing to mention, the head of Health and Human Service recommends their panel for flu vaccines recommended that thimerosal be dropped from flu vaccines for this coming year. Thimerosal is a mercury-based compound that was used years ago, mostly in multi-dosing viruses because it inhibits bacteria and fungi. So it's almost never used in the United States. I mean, there are a couple of percent maybe, but again, only in multi-use vials. So eliminating it seems like a really more of a political statement for drama than it is reality, but there you go. The new vaccine group eliminated thimerosal. I thought today would be actually interesting to talk about West Nile because it's just beginning the West Nile season. The second case in Texas was just recently reported. It was reported in Brazos County. The health department in Texas generally is sampling mosquitoes and looking for what viruses are present, and did detect West Nile virus in Dallas area. So we can expect that starting now through the summer, we'll see more and more cases. It was originally introduced in the United States in 1999, and over the past decade or so, the CDC has reported usually several thousand cases. Texas usually leads the way. Last year, we had 455 West Nile cases with 56 deaths. Dallas County last year reported 37 cases and 3 deaths, so fairly common in Texas. So West Nile virus is the leading cause of mosquito-borne disease in the continental United States. It's most commonly spread by the bite of an infected mosquito, although there have been rare cases of organ transplantation or blood transfusion from an infected person, but the vast majority of cases are from a mosquito bite. The season starts right about now, when the mosquitoes start breeding, and extends into the fall until they stop, until the mosquitoes all die. But in the South, particularly in Texas, it can extend through November and December. There are no vaccines or medications right now to treat West Nile. The vast majority of people who get a mosquito bite, who are infected, have no symptoms at all. About 1 in 5 develop a fever, sometimes a headache, GI symptoms, or a rash. Less than 1%, or 1 in about 150, get very seriously ill, usually an encephalitis that can lead to death. So it's usually not a problem, but it's a significant number of people do get symptomatic, and we have a significant number of deaths each year. So West Nile virus belongs to this flavivirus category, with a bunch of viruses you'll recognize: dengue virus, yellow fever, Zika, St. Louis encephalitis, and several others. So this flaviviruses around are very difficult. West Nile generally is transmitted by the common mosquito Culex species, but the real reservoir is in birds. So these Culex mosquitoes prefer to bite birds, and the virus is living in birds. Every now and then, though, if a female mosquito finds a human and happens to be infected, they will definitely bite a human. Humans are considered a dead-end host because we don't get enough viral load to actually transmit between us, and there's no mechanism for its blood transfusion. And we can't transmit from one person to another even through mosquito bites because there's not enough of a viral load. So we're really not intended. We're not part of the life cycle of the virus like birds are. As I said, it can't be transmitted between people unless there's a blood transfusion or organ donation. Now, what about birds? They're the host. So, crows and jays are the birds that are most susceptible. If you see a dead crow or a dead blue jay, it may well have died from West Nile. Most birds are pretty resistant. But since the discovery of the virus in 1999, there have been over 300 species of birds that are known to be infected. There's no evidence that handling a dead bird will really infect a human, but I would suggest you don't get in the habit of picking up dead animals on the ground and handling them and examining them. If you really want to look at something or move it, put on some gloves. It's found in the 48 contiguous states. It's not found, West Nile is not found in Alaska. It's not found in Hawaii. Anyway, it's so common these days. They used to take birds, if they find a dead bird on the street, the public health department would take it and test it. Right now, we don't do that because there's so much virus around, it's likely to be that. Rather, they've moved to sampling mosquitoes. Now, there are thousands of species of mosquitoes worldwide, but the three most common are Aedes, Culex, and Anopheles. And in urban environments, in the cities, it's usually Aedes or Culex. Anopheles are the primary vector for malaria, but they're found in tropical areas and not in the United States. Aedes mosquitoes are known to transmit dengue fever, Zika, chikungunya, and yellow fever. And Culex mosquitoes, which are the common house mosquito, primarily bite you at night, but they are known to transmit West Nile and St. Louis encephalitis. They prefer birds, but they will do humans. So as I mentioned, Culex transmits West Nile. All three of the Culex species breed in artificial containers, like, if you leave some tires around, there's water that pools in tires, planters that have fluid around the bottoms, pools, kiddie pools that people leave out. These are the things that allow the Culex mosquitoes to breed. They don't fly far. There's usually maximum range is about a half mile. And so, they're the real problem, and most of the public health efforts are focused on trying to eliminate mosquitoes, mosquito control. And the best thing you can do is think about mosquito bites, not think about West Nile and birds and all that. Just if you wear long sleeve shirts in the evening, if you use repellent, that's the best way. So just a little bit about COVID. It's interesting. It's very low right now in the wastewater, very few cases. I still know people who've gotten COVID. But the one thing I wanted to show you is that there tends to be summer waves. So this is most respiratory viruses happen in the winter. It gets worse in the winter, but with COVID, we've had these summer waves. You go back to and these red areas are the summer waves, and you can see there's been peaks. Well, we're right here, so I wouldn't be surprised if we begin to see a peak of COVID, and especially as I mentioned before, there's a new variety that is quickly expanding that came from Asia, China, and has been in Europe. And we'll go over that more in the next couple of weeks. Anyway, I want to end today with some shout-outs. First of all, congratulations to the DeBakey VA that has been designated by the National Pancreas Foundation as the first center of excellence for pancreas care within the VA system. Very, very proud of our VA affiliate. The center offers veterans from around the country a wide range of services, including specialized diagnostic testing, surgical treatment, and patient education programs. And a big shout out to our VA and our Baylor faculty who are caring for veterans with pancreatic disease. Also, congratulations to Dr. Nat Zhao, Assistant Professor of Molecular and Cellular Biology, and Dr. Jeff Rosen, Distinguished Service Professor in Molecular and Cell Biology, who are recipients of new research grants from the Susan G. Komen for their cutting-edge breast cancer research. Dr. Zhao and Dr. Rosen both are members of the Dan L. Duncan Cancer Center here at Baylor College of Medicine. And a shout-out to Dan Chelius, Associate Professor in the Bobby R. Alford Department of Otolaryngology Head and Neck Surgery, is voted President-elect of their society and will serve as the President in 2026. And I want to end today, of course, we've been watching the recovery of efforts of the flooding in the Hill Country in Central Texas during the July 4th holiday. I know many in the Baylor community have been personally affected, and I encourage you to access the resources we have available to support you. We are here to help you during these difficult times. It's important to recognize that adults and children may experience mental health challenges as a result of these floodings and the terrible toll it has paid on all of us. Remember, following Hurricane Harvey in 2017, the faculty in the Department of Psychiatry developed a number of resources to help patients, caregivers, and educators, as well as children, all helping them to deal with their homes and loss of family and friends. These resources have been updated and are available on our website, which is indicated here in our video. So have a wonderful weekend, and I can't wait to see you next week.